Public comment, John, is.
I don't know. I was gonna ask that. That's funny you just brought that up. 'Cause I literally was
And I don't
gonna
know
ask
if you
that
want to do
question.
before and after.
We can't zoom.
I do. I added it. I'll announce that. Okay. I see it's not on the agenda, but
Yeah.
Yeah, but
We're gonna-
some of these.
thank you.
Committee reports and stuff.
How's the kids? Yeah.
okay, it's 9:00
We got the one so far.
on
It's easier, but.
Wednesday, November 10th. We're going to start the Health and Human Services Committee meeting. Before we start, there is a public comment starting the meeting, and it is not on the agenda, but there's going to be another one, public comment, at the end of the meeting. So we will start the meeting. Do I have approval of the agenda? Oh, no, sorry. Public comment first. Anybody in the audience that would like to speak?
Are we able to speak at the end as well, you were saying? Too?
Yep.
Okay. That would be great for me. Yeah,
Okay.
thank you.
No public comment. Consent items. Approval of the agenda. Do I have a motion?
So support.
All in favor, say aye. Aye. Same sign for no. Thank you. Approval of the proposed minutes. Do I have a motion for November 13 on that one?
So move.
Support.
All in favor, say aye.
Aye.
Aye. Same sign for no. Thank you. Action items, none. Discussion items. Number one is Migrant Health Survey in Ottawa County Department of Public Health, cross-county collaboration grant. Heather, I see you are on Zoom.
Hi. Good morning. I am. How's everyone this morning?
Very good.
Good. So I'm going to go ahead and share my screen and talk about our cross collaboration that we did, the county grant. So I'm going to start off with that one, and then we'll move into our migrant health survey. All right. Just want to make sure everybody can see my screen. Are we good to go?
Yep,
Yeah.
we can see it.
Perfect. All right, so our last fiscal year, like the three past years, we've received cross-county collaboration grants that we've done primarily with Allegan County. This year we expanded it to include Kent County as well. And you'll see in one of the slides, we actually included all of the Where One County partners. So as you remember that I also do condom distribution on the side, and we have about 46 county partners across the state of Michigan, and so they were also included in this collaboration grant in one of our activities as well. And feel free to ask questions as we move through. So one of the parts of our grants, and maybe you've heard a little bit about this, is our Step It Up program that Amy Sheely, my colleague, she is in charge of this and brought this both to Allegan and Ottawa County, and then collaborates with the county park system. And as you can see, again, we had a great turnout this year. We had over, I gotta move my thing so I can see we had over 1,000 people participate, excuse me. And of those who participated, 60% whose physical health and 74% whose mental health had worsened during COVID reported an improvement after completing the program. So again, this was a way to kind of implement ways to stay active during COVID, and ways to, again, still kind of be in your social circle and get out with individuals. The other part of our program is the Real Food Can, both here and in Ottawa. So promoting, eating fresh fruits and vegetables, collaborating with our local farmers markets. We were putting out food guides, letting people know where they would be able to access food. And again, Lisa Ugansky was our partner with that here in the health department across both Ottawa and Allegan County. So serving both of those populations. We also did a equity training. So here within the health department, we have a health and equity group or a committee that meets on a regular basis. And we thought it would be really great to, once a year, we do have to have some sort of training for health and equity. And so we brought in Dr. Steve Robbins, and he led a a 2-day webinar or Zoom about understanding systemic racism. And this is where we invited all of our community Wear One partners to be able to participate in the training as well, seeing how it was going to be on Zoom. Again, with all of us working in public health, right, and understanding how racism and other things impact public health, that we thought it would be a great idea to kind of spread that out and have our community partners work with us. So we had about 147 people attend. It was overwhelmingly thoroughly enjoyed, lots of great information for our colleagues and for the participants. Over 89% of the participants agreed or strongly agreed they would see this, see how this work, has a role in assuring culturally sensitive and diverse public health workforce. You can see some of the comments that some of our individuals made regarding taking this, and we're actually going to be bringing him back again this year with monies funded from the same grant again to either maybe do a part 2 or kind of expand on some different topic areas for us. And once again, inviting those county community partners to participate. Excuse me. One of the other trainings that we did was the Sacredness of Trauma. So we partnered with Allegan, Ottawa, and Muskegon counties and with the faith community and looked at how does trauma impact the faith community, the people in our congregations. And we worked with community mental health partners on this. And we did that back in May. We brought, the speaker that we brought in was from Tennessee, and she was amazing and kind of making the bridges and the parallels on how to best serve our not only help empower our faith leaders, but help them serve the people in their congregations and in their local communities.
Hey, Heather?
Yes.
Can I ask a question now?
Sure.
Is this something new? How long has this been under the public health?
The grant itself, this we've had for, I think this is our 4th year.
4th year, okay, okay.
Yep, and it's really a small grant. It's only about $42,000 that they that the state has allotted us. We got it, like I said, this is we're going into our 4th year, and they just continue to give us the money year after year. They really are seeing our health department in particular as being an example for other health departments in terms of the collaboration and the work that we're doing across county lines. Because as we know, right, when you can't use county dollars across those county lines. So how do we, but we know the people that we are serving, right, live in different communities and they're accessing things outside of Ottawa County. And so how do we kind of look at the lakeshore and counties beyond and making sure that we all have the same vision and same goals, but how do we do that in a partnership to reach that together?
But Al, just to clarify, the Sacredness of Trauma, this is the 1st year that that's been run.
Correct. Yep.
Okay, I'm trying to learn a little bit here. What, give me an example of this trauma webinar. What are you hoping to accomplish, I guess?
So when we think about people who experience trauma, right, it could be any variety of things. It can be the fact, it can be something what we consider to maybe not, the passing of an individual in their family, or it could be, sustained trauma over time. And right, and how does that impact them in their way that they access services, in the way that they relate to other people, in the way that they relate in their social circle? How does it impact them at school, right? And so people having an understanding as a community that trauma impacts every kind of aspect of a person, and how can we better serve them? So when we're coming into contact or we're working with individuals, or they're coming up to our window and they're really upset or they're not understanding what's going on, it helps us to take a step back, right, and really see the person as a whole person and not just this one particular situation that we may be engaging with them in, and what may be to them very troublesome, right? But it helps us just kind of see people through a very different lens and connect with people on a different level.
Okay.
And understand that we all experience the world very differently, and that impacts, how we work, right? How we think about others. And I think that, that just kind of helps us to, again, open up our view and how to help and serve the people better in our community and within public health.
Okay. Sorry about interrupting you.
That's good. It's all good.
Yep. All that. So, okay. Thank you.
Yep, you're welcome. And then we also did something around ACEs. And with also partnering with community mental health, we did this with Ottawa, Allegan, and Muskegon County. We had Anna Heard next door from CMH. She gave a presentation on the adverse childhood experiences. So again, looking at trauma, and then everyone who participated in that presentation or in that training was able to receive the Body Keeps score. So again, learning about trauma and how it affects all aspects of our lives. And then the other part of this grant is obviously communicating and reaching out to our local Wear One partners. So again, collaborating with Allegan County, doing condoms by mail. We also were able to pass out around about 70,000 condoms between the two counties. And we have about 46 counties participating in Michigan who are Wear One partners and be able to distribute free condoms or ensure access to free condoms in their community. So even though I've been pretty active in COVID, I still have a little bit of sexual health. It's like I have to take my COVID vaccine hat off and put on my sexual health hat. I feel a little rusty. I'm not gonna lie. So that will continue this fiscal year as well.
Heather,
Yes.
this is Lisa. I wonder too, when we talk about Wear One, could you also just mention that, especially during the COVID, we have been seeing significant increases in some of our sexually transmitted diseases.
Yeah. So
which is really important as to why we focus on this.
yeah, so we're continuing to see an increase in our STIs, our sexually transmitted infections across the county. When we looked at when we were shut down, right, people didn't have access to sexual health care. We did see an increase in our condoms by mail order. People were accessing condoms via our mail program. But again, in terms of looking at new ways to be able to access those sexual health services. So this just plays another important piece in helping to bring down that STI rate.
Heather, sorry, it's me again. Can you
Sorry.
also mention too about the target population? This is not for kids. This is
Right.
intended for adults. So just want you to touch on that. I know there's been
Yep.
some concern about that. We want to make sure people are clear.
Yeah. So just to reiterate too, that this program is geared to those who are 18 to 24. That's our target audience, because when we look at the data and we look at who accesses sexual health services, it is within that age group where we see the most sexually active individuals. So despite what people may have been posting or saying about my program, they left out that significant piece. Not that I don't mind being a Twitter sensation, but I would rather be one with the right information.
Heather, this was many years ago. I bet maybe 3, 4, maybe 5. In this Health and Human Services meeting, when you started rolling this out a little bit, you were putting it in the restrooms at, say, in area bars. Am I correct on that?
Yep. So Wear One has been around since 2014. And
Okay.
we have a variety of different partners. So some of our partners continually are have condoms available all the time. So some of the local bars and restaurants, tattoo parlors. Now we're partnering, bowling alleys, and some partners are only do it on occasion. So for example, Thanksgiving Eve is coming up, which is, as we know, one of the
Big bar night.
most populous bar nights, right, of the year. And so I've reached out to some other partners like Parents, the Kura, in bars and restaurants around GVSU's campus, and they are actually going to have condoms, and we have some sexual health coasters that we created as well that have messages about consent and sexual health in general. So they're going to have packages in the bars and restaurants and coasters for just Thanksgiving Eve. They'll do it again for New Year's Eve. So we have different partners participate in different ways.
Okay, thank you.
Yep. Any other questions? The one thing that is not on this slide that I did kind of mention a little bit earlier is that we did actually partner with Kent County in this grant. And what we did was we expanded our GVSU Allendale Wear One distribution to to GVSU downtown GR. So we have continuity of Wear One and condom distribution across both the GR campus in Kent County with Grand Valley, and then the Ottawa County Grand Valley campus as well. And so that got left off of the slide, but now we have continuity across both GVSU campuses for condom distribution. And the Kent County Health Department have partnered with supplying the condoms and the supplies for us to do that.
Okay. Maybe Lisa can answer this, or you. You always showed charts, graphs of sexually transmitted diseases, where we are in the county. Is that going up or going down? Lisa sounds like it's going up since we started this.
We are not of all sexually transmitted diseases. We have seen some spikes in specific sexually transmitted infections. Gonorrhea, specifically, we've seen a pretty significant spike. I didn't come prepared with that information today. I don't know if Heather did, but certainly if that's of interest, we can do an update on our other communicable diseases, which include sexually transmitted infections.
Yeah, some other in the future, that'd be fine.
Okay, I did want to mention one other thing. Heather, did you want to say something?
Nope, you can go right ahead.
When we design these programs, it's not like we just say, oh, this sounds like a great idea. You know, there's always some foundation to it. We're collecting data, we're analyzing data, we're putting interventions in place to reduce the risk of a public health threat to our community. And Heather presented some really good programming around trauma. I think it's important to note too that in our community health assessment, the last 2 cycles, and I also didn't come prepared with the exact statistics on this, and maybe Patrick could step in here. We do know that a significant proportion of our population has experienced some form of trauma and or some adverse childhood experience that can have profound impacts on their life. And this is why it's just so important to educate our community about these important issues and how we can help people heal, how we can help people get beyond this trauma so that they can be successful in their life.
Go ahead. Any other questions or comments about this portion?
Guys, yeah, Jim's got one.
I've got
All
one.
right.
How do we know that people under 18 do not get these condoms when they're in a basket in a restaurant? Bars, we can tell because they're not old enough to go in there, but restaurants, they are. And especially if you go to Allendale's Grand Valley campus, those are mainly freshmen and sophomores that are on that campus. They're not 18 probably.
So the right now there aren't any restaurants on around GVSU's campus that have regular Wear One condom distribution. It's the liquor store that's across the street, and then all the other Wear One partners are actually on campus. So whether that be the residential housing, that would be the LGBT center, there's a bunch of, of course I can't think of them off the top of my head right now, but a majority of them are actually on campus and not off of campus in terms of bars and restaurants. And the ones that we reached out to in Allendale, again, will be individuals. I mean, and we can't obviously guarantee, right, that no one under the age of 18 is going to get it, but that's who our targeted audience is. And when I look for partners and I'm looking for places to put them, I have that in mind and keep that in mind and let them know that that's who our intended audience is when we talk to the community partners.
Yeah, we all knew that you couldn't have sex before you were 18.
Oh, we did?
Yeah, I mean, we all followed that rule.
Maybe you do.
Heather, thank you. Any
Yeah,
other?
you're welcome.
Okay, next one is Healthy Ottawa Plan. Patrick.
Heather, can you stop sharing your screen?
Yep.
I thought she was going to share the Migrant Survey.
I was going to share the Migrant Survey, but I can do that later or now or whenever, because that was the other part of my thing. So you just let me know when you would like me to do that. But I can stop sharing my screen if you want me to.
Could
Oh,
we
you-
just go right into the migrant survey? Because this is really important before Patrick lines it up, his stuff up.
That's fine. I didn't know you had that. Go ahead.
Thank you. Mhm. Okay. So I'm just going to quickly just do a quick overview of some data and information that we collected. So last fiscal year, we were awarded a 3-year grant to look at the health of our migrant farm workers here in Ottawa County. So our first year was pretty much data collection. So we were able to work with a contractor.
Heather, let me interrupt. Were you trying to share something else? Because we still see your PowerPoint.
Yeah.
Oh, for the heaven's sakes.
You may have to stop sharing and then reshare.
Then do it again. Okay.
There you go.
We're good? Okay, perfect. Sorry about that. The first year of our grant was simply data collection. So going out and collecting the data, asking the questions. We worked with Marty Hill, who we worked with in the past, who put together about 100 question survey for migrant farm workers to be able to take. There was an incentive. They were given a $30 gift card for their time because their time was valuable, and we so appreciated their ability or their willingness to answer those questions, because it took about 20 to 30 minutes for the survey to be given. And so we looked at just like kind of the adult behavior risk survey. So we were asking them questions about their general health, about their access to care, how long they lived in Ottawa County. We asked them about COVID. We asked them questions related to ACEs and trauma. We also asked them questions about inclusivity when they're living here, or for their time period. Do they feel welcome? Do they feel included? And so we kind of asked, like I said, a large variety of questions to be able to get a good snapshot of what kind of is going on in our migrant farm worker community. Along with that, we also invited a variety of individuals to the table. So individuals who serve and work with migrants on a regular basis, whether that be through migrant legal aid, the health department, DHHS, LAUP. We worked with West Ottawa schools who serve the migrant youth during the summer and during the school year. We worked with Bethany Christian Services. So we invited lots of individuals to the table to kind of get that a collective thought process around what questions are important to ask, which data do we, what do we want to know? What do we want to learn? What's working, what's not working? And so they kind of helped to drive the questions that were created for the survey. And then beginning next week, actually, and then also in December, we're going to take the data that I'm going to present to you now, and with that larger group, look at it and start to develop some strategic plans and goals for our year 2 in terms of looking at what can we do collectively as a whole group, and then what can we do individually. So again, thinking about LAUP or the health department or DHHS, what can we do individually that's also going to kind of help move the arrows of the data in the right direction over the next few years. The last time this data was collected was actually 20 years ago. So there hasn't been anything done like this in more than 20 years. So that's just a little background. We were able to conduct the survey with over 300 adult migrants, seasonal farm workers here in Ottawa County. So we looked at specifically just those over the age of 18. The data was collected between May and September, when our farm workers are here. Like I said, they were given a $30 Walmart gift card for participating in the survey itself. Excuse me. And we administer those surveys through either a variety of either attending events that were geared towards migrant farm workers, or if individuals who worked with them on a regular basis, or we partnered with DHS. We went out, we partnered with Intercare. So we had lots of different ways in which how we were accessing or able to administer the survey itself. Here you can see kind of just a listing of some of the camps that we were able to visit, and who gave us permission to come and to administer the survey to their workers. All right, I want to get to the data part here.
Just while Heather's doing that, just to make note, the information on all of the data that we collect is always posted up on our website. Under, if you go on the left side of the screen, it says data, and you can just click on that and access the full report.
So we ask questions just about general health, right? In how they feel like how their health is, poor, good. And the green dots indicate that their health, right, or their percentage is better than the general population when we looked at the adult BRFS. And the red dots indicate where they are worse than the general population. But overall, right, they feel that with their general health, right, is a little bit better than the general population. So you can, and obviously this is self-reported, right? When we all the data that we collected as well. One of the things that we looked at was healthcare coverage, and about 70% of individuals indicated that they did not have any healthcare coverage while they were working here in Ottawa County. We also asked about their consumption of fruits and vegetables during the week. We asked about cigarette smoking and binge drinking. Some of it was, pretty close to the same as when we compared it to the BRFS. We asked about accessing dental care. They've had it, 64% did not access in the past year, which is much higher than our general population. We also asked about had their flu vaccine. About 32% had gotten their flu vaccine. And then we also asked about mammograms, and then for female population and accessing like sexual health services. We also asked about depression, and that 9% reported that they were experiencing some sort of depression, which I think is important given, again, the current state. We saw about 7% experiencing anxiety, which is much less than the general population. I think I want to get to, there was one. Weight control. Here we go. So when we asked about the healthcare coverage, when close to 70% said that they did not have any healthcare coverage, and we asked why, given the reasons that they gave was they didn't know where to get it or how to apply for it, that there was fear of immigration law and enforcement, or their employer simply did not offer it. And so this is kind of where we're going to be digging down as a larger group and looking at, potentially how can we improve the access? What does that look like? What's currently going on in regards to how migrant farm workers do access or have healthcare coverage, and what we can do to improve that. And lack of transportation at the bottom, because many workers who are H-2A workers come here and they do not have any transportation, so they rely on the grower or vans or other transportation in order to bring them places. Of those who did have coverage, a majority of them were using Medicaid. I looked at what, in regards to almost 1 in 4 migrant farm workers had foregone, right, or did not seek health care due to the cost. And so we're doing some more deeper dives into that. And like I mentioned earlier, right, they delayed their medical care for numerous reasons. One of them being transportation, that they couldn't get an appointment soon enough, which I think probably a lot of us can relate to. And then just the cost of healthcare services in general. We also asked about when they do access healthcare or healthcare services or visiting their doctor, do they have any difficulty understanding what's being the information that's being given to them? And a majority of farm workers, right, had problems learning about their health conditions because of the difficulty to understand the written information, right? So it's not written in information that they can understand, and sometimes it's not even in their native language, that being Spanish. So we looked at fruit consumption. I want to get to uses that we asked them about if they've ever used a food pantry in the past. We asked about cigarette smoking, alcohol consumption, and binge drinking. And this is about their personal health care providers. But I wanted to get to kind of their inclusivity. Like I said, 32% had gotten their flu vaccine. And we also asked about if they had gotten their COVID vaccination, and 64% had already received their COVID vaccine as well. We did ask them about if they knew where to go to access sexual health services particularly, and only about 32% knew where or how to do that. And I want to get to sorry, it's a lot of stuff. Here we go. One of the important things too while they're here is about a social support system. Do they have somebody they can go to when they're feeling down, when they need a ride to go somewhere? And we saw that 3 in 10, about 30% of our migrant farm workers report that they have nobody that they can rely on for any practical help, such as picking up groceries, talking about problems, or providing care, which is really sad. Right, they are leaving. We're here, even though they may live in congregate housing or living with other individuals. Right, they've left all of their family and their friends behind, and so having that support, that social network, is super important. So potentially looking at ways that we can increase that for them. And then we also asked about community inclusion and their connectiveness to the community. And 75% believe that Ottawa County is inclusive and welcoming of all people. So I think that's really, I think that's really great. We should be really proud of that. That they feel included and welcomed here, that they feel respected and valued while they're here, and that 65% actually feel like personally connected to our community and the work that they do. So I think that speaks volumes to the community that we have here in Ottawa County, and that makes me really happy to see that. We also asked about discrimination, and they said about almost half of our area migrant farm workers had found it difficult to deal with daily situations, right, such as running errands or shopping because of their difficulty to speak, and that 1 in 9 had experienced discrimination in Ottawa County. And when we asked them where they had experienced this discrimination, you can see on that chart on the right-hand side that a majority of the discrimination happens in the stores and that they're either going to or shopping at, along with their employers, school, and then other co-workers. And so I think it's important for us to know, maybe we can't turn a blind eye that it's not happening, because they are saying that it is, and then specifically where those situations are happening for them. And then we did ask, like I said, about COVID-19. Majority, 64% had received their vaccine. We asked them about, how has their life changed in any way? It's pretty reflective of what the general population was saying as well, that it's about the same. 50% said it was about the same. We asked, what kind of things have you done in response to COVID-19, like personal measures of safety? And obviously you can see wearing a mask, hand washing, all the things that we've been promoting through public health. We asked how it had impacted their lives, right? For those who said their life was made better, right? They were glad to be vaccinated. They were happy for the opportunities for work. That things that were cleaner, more people were taking the time to disinfect things. For those who said that it made their life worse, some of the comments they said was that they couldn't travel to see their family, right? They didn't feel like they had as much freedom. They got really depressed and are still struggling. It was hard to go to work with a mask. Some of them had actually, experienced getting COVID. They couldn't socialize as much. You know, people were losing their jobs and families were struggling. So again, just some realities, right, of how COVID has impacted for better or for worse. And this is just a breakdown of the participants who took advantage of the survey. Right, it was pretty close to having 50% male and female. Majority of our respondents were in that 18 to 34-year-old age range. When we think about migrant farm workers, it tends to be a younger population, which also can, when we think about their general health, probably going to be more healthy than the population as a whole, the countries that they represented, etc. So it's a lot of information. It's a little bit different than the information that I had sent you originally. We had just gotten this data set or this presentation yesterday from Marty, the person that we're working with. And so it's a lot to take in, lots of great information for us to be able to move forward these next 2 years and really take a deep dive and look at what potential impacts we can make within our farm worker community, because they're very important to Ottawa County. All right, any questions on any of that?
Nope, none of us. Thank you, Heather.
Yeah, you're welcome. You're welcome. You have a great day.
A lot of information. I guess we go back to Patrick.
Okay, well, John is going to pull up the slides that I'm going to use, and I want to apologize in advance. I didn't know we were going to have such a data-rich morning, so I've got more data to share. Had I known we were going to cover so much, I would have waited. But I realize as I've been coming to these meetings over the last year, certainly when we talk about health-related issues, COVID has been the dominating issue. And yet, I think there's a lot of other really important issues related to health that many of us have been focused on. And I just want to make sure Board of Commissioners were aware of what are the other issues that many of us are working on, that we've prioritized and that we're actively trying to address. So I'm going to highlight the results of the 2021 Healthy Ottawa Plan. So this is a rebrand. We used to call this the Community Health Improvement Plan. We'd come in every 3 years and share the highlights from that. We rebranded because we think Healthy Ottawa has a little bit better ring to it. And so the background to this is, again, every 3 years we conduct the Community Health Needs Assessment, which is that big data dive into the health and well-being of Ottawa County residents. We contract with an outside firm. Over 1,000 people receive a phone call and are interviewed about their health. And it creates this massive data compilation. And so what we do is we take that data and we develop a plan around it. We bring together the community, over 100 stakeholders from kind of cross sectors, different industries, healthcare, nonprofit, government, faith communities, schools to come together, look at the data and determine what are the greatest priorities and what can we do about them. And so make sure the clicker, John, I'm going to have you advance the slides here since the clicker is not working. So this is the Healthy Ottawa Advisory Council, and I really want to emphasize that this is a collaborative effort that comes together to put this plan together. So we have our 3 hospital systems: Community Mental Health, Public Health, United Way, and then myself representing Community Spoke. And our organization is responsible for actually helping to facilitate this process. So I really want to emphasize the collaboration, because when we first did this 6 years ago, I remember talking to a lot of other counties and saying, what do you do to put your community plan together? And if there was ever more than one hospital system in the county, they did not do it together. So the fact that we have 3 systems, they come together, obviously they have their differences and they compete in other ways, but they come together to actually collaborate on this plan, I think says a lot about our community. And again, I think collaboration is kind of in our blood here in Ottawa County. So in the plan, and it's about a 150-page plan if anyone wants to read all of the details on the Healthy Ottawa website. But if you look through it, it's broken into a couple different categories. So we have 3 priority areas: access to care, mental health, and healthy behaviors. And there's an overarching goal with each of those priority areas. And then we have 3 objectives for each of our priority areas that's tied directly to data in the plan. And then what we do in the planning process is we actually look at the data and say, what's causing this? What are the root causes for why we're seeing what we're seeing? And I think that's part of what really enriches the process. So one of the things we did this year that was different than 3 years ago is we got out and actually interviewed two specific populations, lower income as well as our Hispanic population, because they often are seeing disparate health outcomes. And we talked to them, and we had over 70 interviews related to our health priorities, and just asked them, how are they experiencing this? What are their challenges? And I think a lot of the really good strategies that came out of this came from the conversations we had. And then lastly, we have recommended strategies. So that's where, again, this cross-section of the community comes together and says, here's what we think are the best ways in which we can go about changing this data moving forward. So the three overarching goals related to access to care is to increase access to patient-centered and community-integrated system of care. For mental health, it's to increase recognition and treatment of mental health conditions. And for healthy behaviors, increase the percentage of adults at a healthy weight and decrease barriers to healthy living. So I'll try to go through the three objectives for each of these a little bit quicker than I was planning. If you go to the next one, John, that'd be great. So the first objective for access to care is increased percentage of adults who are confident navigating the healthcare system. The good news is, as you can see on the screen, from 2014 to now, that number has actually been increasing, which says more residents are actually confident navigating the healthcare system. That kind of surprises me, having just gone through open enrollment for my own insurance. I'm surprised that it's actually getting easier for folks, but that's a great sign. But as you'll see in this, the rest of this data, it doesn't mean everybody is becoming more confident navigating. So our non-white population, adults living below poverty, continue to lag behind. And so as we looked at root causes, it's some of the things Heather was talking about. There's language barriers, there's technology barriers, the fact that most doctors' offices are only open from 8 till 5. So what do folks do who are working during those hours, who can't get those hours off? There's a number of these barriers that make it challenging. And that's where the community comes together and comes up with strategies around, doing orientations to help patients understand the technology side of things, or hiring more bilingual staff. The second objective is to increase percentage of adults who have a personal care provider. This number has really hovered around 12% since we started collecting this data. But again, you'll see for subpopulations, our non-white population, younger adults, adults with less than a high school education, much less common that they have a personal care provider. One of the key barriers we found in this space is personal care providers not accepting Medicaid. And that has continued to be a huge challenge for folks that if they have Medicaid, there's not many places for them to go. So some of the strategies suggested is, can we do a better job of advertising which providers actually do accept Medicaid and help save people time, going from door to door. The third objective then for access to care is decreased percentage of adults who have no healthcare due to cost. We know that folks, without insurance is a major challenge. The skyrocketing healthcare costs. Again, you see kind of disparate populations being impacted by this. So some of the strategies, related to this is to encourage our medical providers to be more transparent with what the costs are. Oftentimes we go in for consultation and surgery, we have no idea. And so some of what's coming out of this gives us an opportunity to go back to these major health systems and say, hey, this is what the community is asking for. Are you able to implement any of these strategies? So the second focus area is around mental health. And again, the goal is increased recognition and treatment of mental health conditions. And the first objective, John, if you could advance that. Sorry to make you do this. The first objective is decreased percentage of adults in poor mental health. And I really want to highlight this data point. So if you look at the previous three assessments that we did, the percentage of adults in poor mental health hovered around 8.5%. And really remained unchanged. But in 2020, that number skyrocketed to 15.3%, almost doubled. That's a major jump. I think we all know COVID played a significant role in that, most likely. And even at 15%, you may say, well, you know, how many people really is that? Well, that's 14,000 more Ottawa County adults that would fall into the category of poor mental health. That's significant. And so when Lynn comes here and updates and says, hey, demand is greater than supply right now, you can see why that is. The data clearly shows that. And again, for subpopulations, people who are of lower income, younger adults, they're experiencing this at a much greater degree. So, one of the strategies out of this is pretty simple. And it's just to expand capacity. And what I like about that is, at first you say, well, have more therapists in the community. That's an obvious thing. But when we name that in community plans like this, it helps a lot of our nonprofit providers when they go out and seek funding. And so over the years, we've seen them be able to go to local community foundations and other funders and say, hey, this is a need. And because they can tie it back to our community health plan, they're able to secure more funding. The second objective for mental health is increased percentage of adults receiving treatment or medication for mental health conditions. Similar to the last one, you see a pretty significant decrease here. 3 years ago, we were celebrating how many more adults were actually receiving treatment or medication. And that number has dropped. And again, I think, Lynn would probably attest to this, that with COVID and not being able to get into the office and have consultations early on, that probably had a significant role. So hopefully a blip on the radar. We know one of the root causes of people not seeking treatment is stigma. And so that is one of the strategies, is to really focus on an anti-stigma campaign. I know Lynn, with some of her recent grant dollars and her team, is helping to lead some efforts in that space as well. The third objective then is decreased percentage of adults and youth who have suicide ideation and attempts. And I don't have the historical measure here. I just wanted to share the difference between adults and youth. And you can see it's quite significant that close to 5% of adults in Ottawa County have considered ending their life, while 18.5% of youth. I mean, think about that. Almost 1/5 of our youth have had ideation. Now, I know it's come up at this committee in terms of, is that number increasing? Everything says the number's not necessarily increasing, but it's always been at this kind of higher level, and that's obviously very concerning. So, strategies around helping expand Spectrum Health's Blue Envelope program, which helps, early identification in the schools of kids who might be considering, and also helping kids advocate better for themselves, that oftentimes it gets too far, beyond the point where you can help. And so what are those early signs, and encouraging kids to challenging them to be able to advocate and raise their hand when they realize that they need help.
Patrick?
Yeah, please.
That question right there. Where is there a bar that you are measuring from? Okay, this is Ottawa County facts.
Mm-hmm.
What's Kent County? What is Saginaw County? What is there difference, or are they all that high? You know what I'm saying?
Yeah.
How do we know where we are in the?
It's a good question. I mean, I know historically we look at national and statewide data compared to Ottawa. Lynn, I don't know if you can jump into that. I will say we don't regularly look at other counties, but I don't believe we're much different.
Yeah, so for the sake of this report, we didn't compare ourselves to other counties, but some of that data is available because everybody's doing similar types of assessments and surveys throughout their community.
You get my question. Get my question. Why are we 18%? Oh, that's bad. Well, it is bad, but measuring it over the whole United States, where are we? I don't want to make little of that 18%, but
where are we compared to the state or national? Do you have that off the top of your head, or is it close, or is it?
We are likely very, very close to the state averages. But we can get specific data for you if you'd like us to do that.
I mean, that it's certainly available. I just don't know if I know it off the top of my head.
No, you don't have to. I'm just wondering,
Yep.
Is there a county in Indiana that's at 3%,
Mm-hmm.
and there's a county in Nevada that's at 40%. Well, somebody's doing something different or
Right.
whatever. So, okay.
It's a great, and I'm glad you raise it because that's actually how we develop a lot of the strategies that we do over the years is we are looking at comparison counties and trying to figure out what are they doing to address the same issues that we're wrestling with. But good question.
I just want to jump in to the adult, this data comes from two different surveys. One is the Behavioral Risk Factor Survey, which is a tool designed by the CDC and done across the whole United States. So we'll be able to get that adult data. The youth data comes specifically from our Youth Assessment Survey, which is such an important tool that we use to identify what some of the challenges are for our youth that we need to focus on and do a better job at. I don't know if we'll have comparative data on that exact question. We might get close to it because our survey is somewhat unique to Ottawa County. Other counties use a different tool. So we'll look into that though and get back to you on that.
Okay, so the Youth Assessment Survey is not a world or United States type survey or a Michigan type survey.
No, Michigan uses something called MiFi, and a lot of the questions are very similar.
Okay.
But our community, not me or Patrick or Lynn, as a whole, they've come together and said, we want to know these things too. So there might be some variations, but we'll try to get close for you.
Okay, thank you.
Thanks for clarifying that, Lisa.
Yeah.
The last priority area then is healthy behaviors. And the first objective, John, if you can go to the next screen here, decreased percentage of adults who are obese. So this is another one of those areas that I think we just continue to see staggering growth and not growth in a good way. So, if you look at kind of 2014 to 2020, we've gone from about 24% to almost 35% of our population that would classify as obese, and those that would classify as overweight also is increasing. So certainly something to pay attention to. There are subpopulations that are impacted more, but I think this is one of those categories that it's kind of across the board. It doesn't necessarily matter what demographic you fall into. And so as we know, the two primary strategies around this that our community is focused on is the levers of better eating and the levers of more physical activity. And I think we've started some great programs over the years. Ottawa Food, you heard Heather talk about the Real Food Can campaign, encouraging healthier eating. So more promotion of things like that, promotion of Ottawa County's Step It Up program. So just getting more people active, getting more people eating healthier foods is really the strategies that have been suggested. And then the next two objectives relate to obesity. So number 2, decreased percentage of adults who consume less than 1 fruit and 1 vegetable per day. This is some of the most shocking data to me as someone who eats a lot of fruits and vegetables, but 43.6% of Ottawa County adults eat less than 1 fruit a day. And again, so it's not hard to see why, some of our obesity statistics and others are the way that they are. Vegetable, not far behind, 31.8%, consuming less than 1 vegetable. And those numbers, as you can see, are increasing, again, not in a good way, increasing at a very rapid pace. So back to what I mentioned earlier, some of the strategies are more education, more promotion of some of the things that we've put in place in this community. And then the last one, decreased percentage of adults who engage in no leisure time physical activity. This actually had a positive bump in 2020 after declining for a couple of years. And I think we attribute that again to COVID. More people were home, they were outside, they were active. Hopefully it's not just a blip on the radar and it moves in the positive direction. We'll continue to monitor that. But this is another one where the subpopulation data, I think, is really helpful to understand that people with lower incomes, people with lower education, don't have time for physical activity. Also, with the healthier eating statistics, are worse off. And when we interviewed folks, one of the common things, the common refrains we heard is the fast-paced culture of life. People working 2 jobs, they're juggling kids, after school activities, that there's just not time in the day to work out. There's not time in the day to cook healthy meals. And so that's a real challenge that I think, it's a cultural thing. It's not just here that we have to struggle with. So how do we find those little interventions that people can do to again have more physical activity in their lives and to begin to eat healthier? So my goal today is really, I want to highlight, here's kind of the 9 broader objectives and data points that from a health perspective we are really focused on as a community, and then these recommended strategies go out into the community and individuals and organizations pick them up and run with them. A couple of things to come out of past plans that may be familiar to this group: our Pathways to Better Health program, which is our community health worker program that lives at the health department, which has been very successful. That came out of this planning process. There was a lot of support for the mental health millage a number of years ago that came out of this planning process. Our Thrive Ottawa County effort, which is to help educate the community about adverse childhood experiences, came out of previous planning programs or planning processes related to the Healthy Ottawa Plan. So a lot of good past success. I don't know which of these strategies will get picked up on over the next 3 years, but I really want to make sure that this group is aware of what are the other health priorities that we are wrestling with, and just to know that we are all working collaboratively on addressing these. So happy to answer any questions about the Healthy Ottawa Plan. And then also I did hand out just a short infographic here that kind of very top level what the priority areas are. And then, information about where you can find more information, which is the Healthy Ottawa website. And if you really like data, there's the full report can be found there as well.
So wine wouldn't cover the fruit of the day, would it?
Depends on how you interpret the question.
Okay, any questions for Patrick?
No. Good job, Patrick.
Yeah, thank you. Okay, let's go department updates. And since Lynn is sitting here so patiently, we're going to start with Lynn.
Oh, thank you. So I think I've let you know the last couple of times I've been here that we have been extremely busy. I'll give you an example. Requests for services. On any given day, we have about 35 intake appointments scheduled on our books. Last week or 2 weeks ago, that number almost doubled. We had about 69 intake appointments scheduled. So the demand for services is just really skyrocketing. In a lot of ways, that's good because people are reaching out and asking for help when they need it. We've been telling people for years that that's what they should do, and that's a good thing. The downside is it's been incredibly difficult to keep up with that demand. Like every other industry, we are struggling with staffing shortages, and that goes from direct care workers all the way up to master's level clinicians, and lots of reasons for that. If anybody has the solution, let me know. I'd appreciate knowing how we can address that. We are doing things to help our provider network, those organizations that we contract with. We've, for the last year and a half, been really paying close attention to how they're doing so that we don't have any closures of programs. We've increased rates, Medicaid rates, and we're also using some one-time millage funds. It'll actually likely be one-time a year millage funds to help our provider network stay stable. For instance, our group home providers are having to pay all sorts of overtime for the staff that they have been able to get. So we're trying to help them out the best we can and stay in touch with where they're at. We're talking about some ideas to use some additional millage dollars in our savings that could help support more treatment and behavioral health in our community with some of our other local agencies, primarily focusing on people with low income and youth. As Patrick said, there's great needs in those two So I've talked to you about our CCBHC grant, that's Certified Community Behavioral Health Clinics. That's a SAMHSA grant that we received. That is going to bring in about $2 million a year for at least 2 years, likely longer than that. But it's a huge grant with quite a few staff. We are hiring as many staff as we can, running into some problems with certain staff like medical assistants. There's a great need for that in the community. So we've got quite a bit of competition, but nonetheless, we're moving forward with that grant. The intent again is to improve our coordination of care with physical health care and primary care. So I think that's going to be a good thing once it gets up. We have to start technically on December 30th. The last thing I'll say is I do appreciate the efforts that several of you have made in reaching out to our legislators about the current proposals that are out to significantly change the public mental health system in Michigan. I know that a couple of you have reached out, and I've heard back as I'm talking to legislators that they appreciate those calls. So if you're inclined, keep doing that, because the pressure is increasing, particularly with Senator Shirkey's bills. And I'm happy to answer any questions you might have about those particular bills or anything else I've said today. That's all I have.
Lynn, on those bills, do you know where they are? I mean, they're out of committee. And do they have a time frame when they want to vote on those, or have you heard?
No time frame that I'm aware of, but yes, Senator Shirkey's bills are currently in the Senate, and Mary Whiteford's. I don't know if it's actually her bills have been pushed out yet. I think they might still be in committee.
Okay.
They look like originally, at least Shirkey's bills were going to be tied to the budget. Obviously, that's not true. So I have not heard any further information about when they're trying to push those for a full vote.
And John, Bob DeVries is aware of these bills too, right?
Oh, yeah.
And that lobby organization is pushing pressure on him too, saying, hey.
No, they're aware. Our legislators are aware of our position on these bills. Our expectation is there's a decent chance Senator Shirkey's bills will pass because he's the Senate Majority Leader. Its fate in the House is a little less certain than that. We are trying to work with Representative Whiteford to see if she's open to making some significant revisions to her bills, because usually we're in a better place if we can say we're working to try to make things better than versus just saying no, 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 no. But we do expect Senator Shirkey's bills most likely to pass. Even if our own senator votes against it, I think the votes are probably there.
If I'm reading Roger Victory, he's going to vote for it.
Yeah.
And
even if he, I think there's a pretty good majority. But again, the fate in the House is less certain on that, frankly.
But okay.
And that the fear is that's going to eliminate your department over the years. Is that what that is? Or the third party comes in and replaces you, or would you still be there and you just work with the third party?
So my concerns primarily with Senator Shirkey's is it opens up. So he's suggesting that the funding get transferred to a new organization, which is a specialty integration plan, which is a healthcare insurance plan that is likely going to be private for profit. So one of my concerns is it's shifting the oversight and management of our programming funds to an organization that is going to be looking for profits. It talks about opening up the contracts that the SIPs will be engaged into, not only CMHs, but private organizations besides us, which I I have concerns about, because it's sort of, if our funding starts being given away, my ability to manage and take care of people who are high acuity, who need expensive services starts to dwindle. And it really removes public oversight. Right now in my board by mental health code, which is law, has to have representation of consumers and secondary consumers, family members. There's no place for that in a private company, $1 billion company, but likely that is headquarters in Massachusetts or whatever. So there's a great fear of the loss of local governance and control as well. So those are my primary concerns.
What does that do with the LRE then? Anything? Or?
Yeah, it would take over for the LRE. The regional entities, the Lakeshore regional entity would no longer exist in that model.
I haven't heard about any funding issues. Did that finally all get figured out then?
Yep, we're doing much better financially. Our revenue, they adjusted the Medicaid rates, which over the last 6-7 years, that's what I kept saying was our Medicaid rates are not adequate to cover our costs. And they adjusted the rate formula and our rates are good right now. So that's.
Is this trying to like fix that?
No.
Or is this just something?
Senator Shirkey would tell you his motivation is integration of healthcare, physical healthcare and behavioral healthcare. And that sounds like a great idea, right? I don't know that anybody would say integrating both behavioral health and physical health is a bad idea. I don't think just moving the funds and the management of those funds is going to get us any further along the road of integration. We have lots of really good examples of where we're working on that or already made lots of progress. That program I told you about, CCBHC, that is a model that is truly focused on integrating physical healthcare and mental health care. And those are models, it's a federal program that the states are implementing in years of data to suggest that that is a good program and it works. So I think there are other ways to address his desire to integrate healthcare than simply moving the funds.
Lynn, are you concerned that those private health care plans would take the Medicaid funding and deal with the quote unquote easiest cases, and then we'd have very little funding left to take on the very most acute cases of mental health care?
There's potential for that. One of the roles we play as a community mental health organization within our communities is that safety net. So, and by that, I mean, we get calls from Matt Messer at Holland PD, and he says, hey, Lynn, we've been called out to this home multiple times. Could you help us figure out how to help this person so that they're not in their front yard doing whatever? And we work with them and we figure it out. And sometimes those people cost a lot of money to take care of. Sometimes we have to put them in a residential setting to kind of for their safety. And those programs can cost upwards of $400 a day. So if your motivation is to look for profit, you're probably not going to look for people to serve people who cost $410 a day to take care of. So one of my fears definitely is that there'll be some cherry picking, like, yep, this organization, we'll take care of this group of people, but we're not really interested in taking care of the most difficult or the most costly, which will remain in my lap, but I'll have less money to do it.
And less staff at that point if you have that much less money.
Right. If I don't have money, I don't have staff.
Any other questions for Lynn? Okay, Patrick, do you want to?
I'll let my earlier report be my update.
Okay. Lisa, you're up.
Hi, everybody. I'm going to keep mine very short too. I'll be sending out our weekly Colbert Report, but just a couple quick updates. We are seeing real significant upticks in the number of cases among all community members. We are also seeing significant increases in outbreaks among school children. Last week, our case counts were 42% higher than the previous week. Last week for children, case counts increased 54% for the previous week. So we're watching this closely. We know that our hospitalizations have also been increasing along with the case rate increases. We are seeing a lot more people come in for testing. Heather, who she mentioned that she wears a lot of hats, she also is leading the charge here in our organization to ensure that we have enough testing in our community. And she's been doing a great job, but she and our other partners who provide testing are reporting that they're pretty overwhelmed right now. So we're trying to figure out what we can do with that, if anything. You know, for us, we're struggling a little bit with staffing right now. It kind of ebbs and flows, but right now with additional vaccination clinics, with additional demand for testing, we're challenged. Our staff continues to work lots of overtime. They're tired. They're real tired. We've had about 20 people leave the organization since the beginning of the pandemic, which puts us behind even further when we have to go out there and try to do recruitment and hiring, the whole hiring process and everything. So we're doing the best we can to keep up on good communications and all of the work that we have to do in the COVID space, as well as all of the other really, really important services that we provide for our community. One of those, and I should mention, we've got a staff shortage currently in our sustainability program. We did have to close one of our sites in Coopersville this week for a day because one of our staff had an emergency, another was on a medical leave, and we've got a couple of retirements coming up. So we're struggling a little bit with that program to keep it staffed and open. So I'll be sure to notify you if we have to close things. It's as far in advance as I possibly can, but just know that we're stretched.
Okay, any questions for Lisa? Kyle?
Hey, Lisa, I know
Kyle, do you want to just speak closer to the mic so she can hear?
Hey, Lisa, the mask mandate's coming off January 2nd. With all the cases and stuff going up, are you guys thinking about extending it or doing another one?
That's such a great question, Kyle, and I'm glad to be able to clarify that. No, we are not planning to extend that. We, from the start, said that when the vaccine became available and parents who choose vaccine, this is parents' choice, when parents choose to vaccinate their kids, those children will now have a layer of protection. Those same parents can send their child to school in a mask. The other side of the issue is that those parents who choose not to mask and not to vaccinate will also have choice not to do that. So we're sticking with the plan. I will say on top of that, though, I'm very concerned about the amount of transmission that we have in our community. We've reached a point where recommendations used to be taken very seriously. We'd make a recommendation based on, the World Health Organization and the American Academy of Pediatrics and the CDC and all of the experts that are monitoring the situation all the time. And people would go, wow, that must be something I need to do. Well, now it's morphed into, if there's not someone ordering me to do it, I'm not going to do it. I'm just going to step back from that for a minute and just say, let's add an amount of common sense in here. There's a communicable disease that's swirling in our community. And if you want to protect yourself from it, and if you want to protect your family and those around you from it, please use those tried and true mitigation strategies, which we've communicated from the beginning, which is, if you're okay with it, get a vaccine. Use a mask when you're out in crowded places. The Delta variant finds people. we are seeing about 30% of our cases right now within the vaccinated population. We've got outbreaks at long-term care facilities, continuing hand washing and distancing, and just all of the really important stuff to keep you safe and to keep those around you that you care about safe. And we will be encouraging the schools to do the same, but it will not be a mandate. It will be a recommendation.
Lisa, you mentioned hospitalizations are up and you've said that COVID generally affects adults more than kids. So with the hospitalizations, is that increase really just with adults, or are you seeing any corresponding increase with children hospitalizations, or not really?
We are. So I'm reading off my screen here. 2 weeks ago, the inpatient census for children with COVID-19 at one of our large regional systems reached the highest point in any time in the pandemic for children. And so you're right, John, and I'm not trying to be extremist here. It is less serious for children with regard to how many children get severe COVID disease, but we are seeing the highest amount of children hospitalized since the beginning of the pandemic. And so it does happen. I think right now the CDC is reporting that COVID-19 for children between 5 and 11, which is the age group that was just approved for the vaccine, is the 8th leading cause of death for children. So we may not have had any deaths. I know we've had people come to the commissioner meetings and say, we've had 0 deaths. And you're right, that is really, really good news. I want to give credit to everybody for taking that seriously and keeping our kids safe in school and putting the strategies in place. But now we're seeing an uptake and we have to be careful. I wouldn't want anybody's child to have to be hospitalized. It's traumatic. And it's not just about deaths. There's long haul syndrome. There's all kinds of other things. So it's just something that we really need to take seriously and pay attention to.
I just got one more.
Yeah.
This is the last one. What the number of the kids in the hospital is? You said it was that number.
Kyle, it changes week to week. So for the same period, last week, the census was 14. But it's likely higher than that because of how they input the statistics. And, you know, because we don't have access to hospital data, it's hard for us to know exactly the number and when they come in and when they go out and which area they come from. And we've been working closely with our hospital systems to try to do a better job of communicating that to our community. But that's the best I can do for today.
Okay.
Any other questions, Lisa? Thank you, Lisa.
You bet.
Okay, I thought I saw on the screen either Kendra or Jennifer.
So they both had to leave. You can see Kendra's chat below. She's working closely with Tom Laddick from Juvenile Court to maximize our county child care funds and ways to expand prevention options to keep kids and families in our community.
Okay.
Jen just had a quick reminder, our Walk for Warmth will be in person Saturday, February 5th at 8:30 in the morning. And obviously that's to help people whose heat has been turned off to provide the funds to keep that heat on.
Okay.
So
Thank you, John. I guess that's it for the updates. Public comment, second on the last time.
And how many minutes?
3 minutes. We gave everybody 3 minutes. We'll give you 3 minutes. I need your name and your municipality would be fine.
Sure. My name is Sylvia Rohde and I live in Allendale. Michigan School Code affirms it is the natural, fundamental right of parents and legal guardians to determine and direct the care, teaching, and education of their children. In a legal opinion on parental rights, Ken Paxton, Attorney General of Texas, explains, the Due Process Clause of the 14th Amendment protects certain fundamental parental rights, including the right of parents to make decisions concerning the care, custody, and control of their children, to direct the upbringing and education of their children, the right to make medical decisions on behalf of their children, and in conjunction with the First Amendment, to guide the religious future and education of their children. Constitutional rights are not suspended in times of crisis or the presence of a virus. There have been 0 deaths in children, and parents have 0 confidence left in the decisions the health department makes in the place of parents. On November 3, Lisa Stefanowski commented, "We respect the rights of parents to choose what medical measures are right for their child." Yet the health department continues the mask order for children through January 2. Ottawa's children have already endured over 220 days of masks, with significant negative socio-emotional and educational ramifications. It is beyond clear COVID-19 does not significantly impact children, yet Ottawa continues its mask order in violation of state law prohibiting such orders, while overriding the constitutional rights of parents. We ask the county to stop pushing testing and quarantines on students. Please make public recent orders or guidelines issued to healthcare providers and schools regarding COVID-19 testing and the quarantine of students who are ill from any source, missed school due to an illness, and/or have been potentially exposed to COVID-19. The mental health and education of students are significantly impacted by quarantines, and assumption of any illness to be COVID, and thus push testing, is not protective of the overall well-being of children. Vaccine clinics for little ones are now taking place on school campuses in Ottawa, including a private Christian school, when it is known many parents have religious objections to the COVID-19 vaccine. School grounds should be free of controversial clinics, and we ask the county to remove the clinics so parents can be confident their right to direct the care of their children will be respected. Constitutional freedoms and parental rights need to be restored and protected in Ottawa County. We ask you to give direction to the health department in these matters and to use your statutory authority to make changes in leadership and funding. Thank you.
Thank you. State your name and your municipality, and you've got 3 minutes.
Sure. It's Emily Underhill from Allendale. At the last meeting last month, I believe it was MetLink that mentioned, hey, let's pay attention to maybe one of the counties that has dropped their mask mandate. I believe that was Allegan. Try to pay attention to their data and see like what happens when kids are unmasked. We don't need to rely on Allegan's data because we dropped it on June 22nd for the entire state. If you look at your website on Ottawa County right now, you can see where that happened. The entire summer, kids all around, no masks, no social distancing, nobody's dying, no kids are dropping dead. From ages 0 to 10 in Michigan, there's 0 deaths. And I get that we keep counting cases. And the fact that last month, Glenn mentioned that we're just gonna assume everything's COVID until proven, this will never end. Where is the end game in that for these kids? And we just keep counting cases like that. I just can't get over it. 2, 4, 5, 6 years ago, I spent so many days in the hospital with my son, begging them to test him because he couldn't breathe. About 4 years straight. They never would. They told me his body would have to get over it on its own. The fact that we're pulling healthy kids out of school and testing them, sure, Lisa, the cases have risen because you're forcing them to test to go to school. People can't even stay home with a headache and they'll be told to quarantine for 14 days. I just don't understand what the end game is in this. People need to understand what's really going on. Kids are not dropping dead. It's cases. And a lot of healthy ones too. I think we need to really be talking about the data that's going on and not just pushing fear everywhere. Another thing that's interesting is this summer, so the mask mandate was dropped June 22nd. On August 6th, the quarantine public health order was put in place. And guess what? Tons of pop-up sites go around. Check to see if you have COVID. Are you scared you have COVID? Please go test. Please go test. Guess what? Cases rise. Cases rise, not deaths. And then guess what? August 20th is the public order mask mandate because we went from substantial to high because you told people to go test. I mean, we got to start thinking logically. It's insane. And if we're in a pandemic, if these metrics put in place are supposed to help the pandemic, why is it when a mask mandate happens on August 20th, cases are on the rise? Shouldn't a mask mandate help the pandemic if we're even in a pandemic? We got to start thinking, no masks, no cases. masks, tons of cases, because everybody thinks they need to run out and test. Again, just very passionate about this and want everybody to know. Thank you very much.
Thank you, Emily. No one else out there. I only have one thing to cover. Our next meeting is December 8th. And that's also ready for school breakfast that I'm going to, and I don't get done until 9 o'clock. So I'm more than willing to move it back a week. That would be December 15, I think, the Wednesday after our first commission meeting.
Is this one where you said your other commitment ends at 9 o'clock? Is it
Yeah.
something where if we push it, this meeting back to
9:30?
9:30?
Yeah, that would work too. What would
That-
you, you guys got a preference? What you want?
It don't matter.
No,
That's fine.
9:30 is good.
9:30?
Sure.
Or in the afternoon.
That's happy hour.
All right, so we'll do next month's meeting on Wednesday, December 8th at 9:30 PM.
Yeah, okay. And
30 AM.
John, just do a little housekeeping here, a little bit on here. Who makes out the agenda? It fills out, is that Regina? Would you have her add the public comment for the second one?
Yep.
And then is she also gonna update the calendar? The county calendar and everything that this meeting starts at 9:30?
Yeah, because we're gonna have to publicly notice it at
Yeah,
9:30 just to
Yeah.
comply with the.
Okay,
Meetings Act.
okay.
Yep.
And I don't have to do anything?
No, you don't have, we'll take care of it.
Okay, thank you. So this meeting is adjourned. Thank you, guys.
Thanks. I don't think I eat more than food.